Hey, this is Rick Caselge, injury specialist from exercisesforinjuries.com. In this video, I wanted to go through the 5 steps to get rid of chronic hip pain. Now, step 1 ends up being hip pain treatment. So this ends up being important and focusing on the right treatment when it comes to hip pain. And what that is focusing in on a injury-specific sequential exercise plan. So doing a exercise program that's specific for your injury, hip pain, that ends up being sequential, so it ends up kind of moving in a logical progression, kind of challenging your body and helping when it comes to your hip pain, and there ends up being a plan. So just doing random exercises don't help. You end up needing to kind of follow a specific plan. And this video ends up being a good plan for you to follow. So that ends up being kind of step 1. And along with step 1 is you want to find out exactly what the cause of your hip pain is and what specific type of hip pain you have. So you might go see your doctor, find out exactly what type of hip pain you have, or your primary care professional. Then moving on to step 2 is looking at an assessment, doing an assessment on yourself to see what the movements are when it relates to your hip. And I'll go through a quick assessment with Andrea. So we're going to move to the floor. I'm going to go through the 6 key movements in the hip. And so the first one ends up being flexion. So you're going to grab your knee and pull it towards your chest. And what you're looking at is having good movement in that hip. So you're able to get well past 90 degrees. So you're able to get well past 90 degrees, able to get to like 110 or even like 130 degrees. So that ends up being flexion. Then you can rotate over onto your stomach, and then you can go in the opposite direction. So hip extension, lifting that leg up and bring it back down. So you definitely want to have that thigh off the ground, or ideally about 30 degrees with hip extension. So those are the first 2 movements. Now, moving on to the third movement, I'll get you to lie on your back, is we end up doing abduction and adduction. So with this one, Andrea's got her leg at 0, and then you're going to bring it out to the side. So you're looking at roughly 45 degrees of abduction, being able to bring that leg out to the side. And then from here, adduction, so bring the leg in, we're looking at 20 degrees, 30 degrees, ideally, that we want with adduction. And then looking at the third group of movements, so this ends up being the 5th and 6th movement, we're looking at rotation. So bringing that knee up, rotating the leg in, and rotating that leg out. So we're looking at bringing the heel in, that ends up being external rotation. Bring that heel out, that ends up being internal rotation. Now with people with hip pain, a lot of times they end up having difficulty when it comes to bringing that heel out. So end up being that internal rotation. Now if you don't have someone to kind of guide you through that movement and to see if you end up having roughly 45 degrees in both directions, another way that you can do it is you can move over onto your stomach. And you can just bend one leg up, and then you can bring the leg to the side. Key thing to remember is you're not moving in your pelvis, and then you're moving that leg in. So bringing that heel out, okay, or bringing that heel in. And the key things are you're looking at what's happening in the thigh when it comes to what type of rotation it is. So bringing that heel out ends up being internal rotation, bringing the heel in ends up being external rotation at the hip. And by going through that little simple assessment of those 6 different movements, it'll give you an idea of what movements you need to work on when it relates to tension, when it relates to flexibility, and also when it comes to strength that you need to kind of focus in on. So after you got that hip pain assessment, we'll move on to the third step when it comes to getting rid of chronic hip pain, and that ends up being doing specific hip pain massage exercises. Now, I'll get Andrea to go through 4 of them, and what we're looking at is targeting those muscles around the hip that are most oftentimes tight and have tension, and end up pulling on that hip, not allowing that hip to heal and recover, and overcome that hip pain. So the first one ends up being a glute medius exercise. So we've got the foam roller. This is a 3-foot foam roller. You don't necessarily need a 3-foot foam roller. A 1-foot ends up being perfectly fine. Andrea ends up having the foam roller at like a 45 degree to her body, and she's going to end up starting at just above the sit bones, and then she's going to roll to the top of her pelvis. And what she's targeting there is glute medius, which oftentimes is a muscle that ends up getting tight with people with hip pain because it ends up being overworked, because it's working hard to help when it comes to stabilizing that pelvis. You're going to go up and down that muscle, 5 times, so a total of 10, smooth controlled movement. You're looking for light sensitivity or light massage, so it shouldn't be screaming pain. You should feel a little uncomfortable, but not screaming pain. Now moving from that one, the glute medius, then we end up moving to the piriformis. Good. So foam rollers on the right side, cross the right leg over, that opens up the hip area. Then we can end up getting the piriformis, which ends up being a deep rotator muscle, which oftentimes ends up being tight in people and oftentimes ends up being over tight with people with hip pain. So this ends up being a small movement. You end up rocking back and forth, targeting that muscle, and oftentimes it'll catch you. It'll be like, whoa, okay, wow, that was tight. And when what you're looking at tends to be around that sit bone muscle that you're working on. And you're going back and forth, small movements. Start off with like 3, so a total of 6, and then you can progress to 5, so a total of 10. Now going from there, we're going to end up moving to the IT band. So we're working on the outer part of the hip. Good, so going from just below the hip joint and rolling up that outer part of the thigh just to above the knee. Moving up and down, looking at 5 repetitions, so a total of 10, massaging that outer part of the thigh, so that IT band, which oftentimes ends up being tight in people, especially with people with hip pain. And then that ends up being IT band, foam roller exercise or self-massage exercise. Then we're going to go to the last one, the 4th one, and that ends up being a quad foam roller exercise. So good. So you kind of just have half your body on the foam roller. You're going to start with just below the hip and then moving to just above the knee, working through that belly of that quadricep muscle and moving up and down. 5 repetitions, so a total of 10. And with all 4 of these, perfect, Andrea, for all 4 of these, what we're really doing is we're self-massaging the muscles around the hip, specifically targeting the ones that tend to be tight, that end up leading to putting unnecessary tension and pull on that hip, which ends up kind of leading to more hip pain and kind of prevents you from overcoming hip pain. So that ends up being the first step. First step when it comes to the exercise side of things, but now moving specifically to the 4th step when it comes to getting rid of chronic hip pain, we want to end up looking at the hip pain relief exercises, and there ends up being 3 that I end up giving people. So the first one ends up being a hip flexor stretch. So perfect, there we go. So 90 degrees in the front, flat foot here, bent in the knee, 90, and then the back leg, foot flat, 90 when it comes to the ankle, knee, and the hip. And then you're going to tighten up the abdominal area, bring that arm overhead, and then bring that hip forward. And then you're looking for a stretch in the front of the hip, in the front of the thigh, looking for a light stretch. You're not looking at the muscle being ripped apart, light stretch, holding that for 20 seconds, and then moving over to the other side. And you do twice on each side, alternating back and forth. And what we're focusing in on is the hip, quadricep muscles and the hip flexors, which are ending up pulling on that hip joint and leading to that hip pain and slowing down recovery and overcoming that hip pain. Now, the second one of these hip pain relief exercise ends up being back arches. So I'm going to get Andrea to kind of go through that. Hands are like on your pelvis. And then you're going to arch back in the low back, but then you're also bringing the hips forward. Good. Just coming to a stop position back to the start. Okay, good. And then again, hands on the hips. Bring the hips forward, arching through the back, and coming back to the start. So with this one, what we're doing is we're working on the mobility in the back. So looking at the spine and the whole body, when there's tight spots within the spine or throughout the body, other parts end up having to do more of the work. So let's say you have poor mobility and movement in the low back, then more pressure ends up being put on the mid back and the hip area, and one of those areas has to give, and a lot of times it ends up being that hip area. So we want to improve the movement in the low back, and then also adding that bringing the hips forward ends up working on the extension part of the hip, which a lot of people ends up being poor in people. So it's kind of an odd exercise, but ends up being very helpful when it comes to people with hip pain. And then the third one in the hip pain relief exercises ends up being leg on the wall, and we will just use a chair to kind of demonstrate this one. So you're lying down, and then you're going to bring one leg up against the wall, and you're going to bring that leg back as far as you can until you feel a light stretch. So we're looking at stretching the hamstring area and in the glutes area, because a lot of times in people, those muscles end up being tight, especially people that have hip pain, and we want to lengthen and loosen those so it ends up putting less stress on the hip, leading to less hip pain. Okay, so that ends up wrapping up the fourth step. Now we'll end up moving into the fifth step. Now with the fifth step, what we're doing here is we're focusing in on hip pain exercises. And I'll get Andrea to go through them. So with this one, you're lying down, and what we're going to start off with is a bridging movement. So feet are about hip width apart. You're going to push down with your legs. You're going to lift your seat up, and you're going to hold that position. So that ends up being level one. So you can even go down just a little bit. Yeah. So you can start off with just lifting your seat off the mat about a hand width. That's kind of like level one. And then level two is pressing up and bringing those hips high so your knees, hips, and shoulders are in line. And we're really targeting the glutes and glute maximus and hamstring. And with this one, a lot of times when it comes to hip pain, there ends up being weakness in that glute maximus area. And a lot of times if we can activate and strengthen that glute maximus, it ends up having a big effect on hip pain. Now the second exercise when it comes to hip pain exercises is to do a clam exercise. So you're lying on your side like Andrea is, and ideally get you to lie all the way down. Yeah, perfect. Slight bend in the hips, slight bend in the knees, and now what she's going to do is pivot in the heels and separate the knees. Good. And then come back together. Now, after doing a couple repetitions, you're not going to feel much, but when you start getting to like the 5th, 8th, 10th repetition, then you're going to start feeling it. And what you're targeting is, if you take your hand and pretend you're putting your hands into the back pocket of your jeans, you can feel the muscle that you're targeting. You end up targeting something called gluteus medius, which ends up being a stabilizing muscle in the hip. Perfect. Now with this exercise, the clam exercise, start off with 5 repetitions on each side, smooth controlled movement, and you just alternate back and forth. You can progress to 10. Now with the one before, the bridging, pick whichever one is that works for you, hand width off the ground or hips high. And with that one, start off with 5 repetitions, smooth controlled movement, and going to an end position for about a second or two, and then you can end up progressing to 10 repetitions. Now, the third one that I end up doing, and this one I end up calling is like the number one hip pain exercise, and it ends up being involving standing, single leg standing. So with this one, you're standing on one leg, yeah, and you can start off with putting the hand up against the wall, because in order to kind of master and understand the movement, and then you can move your hand away. So you're standing on one leg, so there's a slight bend in the knee, and we're working on keeping that pelvis square, so you're not dropping the hip, we get nice and square. So you're tightening the abdominal area, you're keeping your pelvis square, and you're really working on the outer part of the hip, working on the stability of the hip. Now if that ends up being too easy, you can end up progressing to like a single leg squat. So standing on one leg, bending the ankle, knee, and the hip, good, and then coming back up, good. Going down again, good, and back up. So really working hard to keep that pelvis square. Good, coming down, good, and back up. Excellent. If you find that your hip starts wobbling, slow down the movement and decrease how far that you end up going down. So you want to go in the range that you end up having perfect technique. And as you do that range that you have perfect technique, you'll find in time you'll be able to go deeper and deeper. So with this one, you're going to end up doing 5 repetitions on each side, alternating back and forth. Now with the one before, the single leg standing, I would start off with just standing on one leg, 5-10 seconds, alternate back and forth, 5 repetitions. And when you're able to easily do the 5 repetitions, 10-second hold, then move to the next level, which ends up being that single leg squat. And then the third level ends up being a single leg squat with a hip drop. So you're going to go into that single leg squat movement. At the bottom, you're going to kind of drop your hip, and then you're going to bring that hip up and straighten out. Good. Coming down, dropping the hip. Good. And then what we're doing is we're really targeting more that glute medius and challenging that glute medius muscle. So oftentimes with hip pain, that glute medius muscle will end up being overworked. It might not function properly. And with this single leg squatting, single leg standing, and the single leg hip drop, we're waking up that muscle and challenging that muscle in order to help stabilize the pelvis and help overcome hip pain. So that ends up being the 5 steps when it comes to how to get rid of chronic hip pain. But I wanted to cover 3 more things that that are kind of common when it comes to my clients when it relates to hip pain. So the first thing ends up being, what are some of the most common causes of hip pain? And number 1 ends up being arthritis. And arthritis is common with people as we end up aging, and if you end up having a previous injury or if you end up being overweight, the hip ends up getting a lot of wear and tear on it. So it really is important to kind of follow the 5 steps that I went through in order to address arthritic hip pain. And the second one, and we've talked about it a lot, ends up being hip tightness. So tightness in one of those areas around the hip. Could be the thigh, IT band, hamstring, glutes, adductors. So working on addressing that tension in order to decrease the pull on the hip joint in order to overcome hip pain. The third cause ends up being bursitis or tendinitis. In the hip, there's all kinds of bursa, there's all kinds of tendons, and with overuse and wear and tear, the bursa might end up getting inflamed, or the tendon might end up getting inflamed, and it then ends up needing to be addressed. A lot of times the 5 steps that I went through will end up helping. And the fourth one ends up being a hip fracture. And a lot of times with that, it ends up being someone it has fallen on the hip, and they might not feel anything and feel fine, and it might end up being an issue down the road. But if you've had a fall on the hip, get it looked at, because if it is a hip fracture, it's something serious that needs to be dealt with. Now, the 2 other things that I wanted to go through ends up being, the first one ends up being relating to pain when squatting. Okay, when it comes to squatting and hip pain, this ends up being a common thing with people that have hip pain that are, work out in the gym, or that just end up having hip pain from doing day-to-day activities. And they ask me, what can they do about it? The first thing that I end up recommending them to do is to address the tension around that hip. And we went through that when it comes to one of the steps in the 5 steps to get rid of chronic hip pain. So go back to that part and go through those self-massage or foam rolling exercises that end up addressing the areas that are tight around the hip. And one thing that you can end up trying is go through those foam rolling exercises just on one side and then see how it ends up feeling. Go to your workout or go through that squatting movement and see how that hip feels. If there ends up being a decrease in hip pain, then it ends up showing that there's benefit in doing that, and then I would end up doing it on both sides and do it more frequently so you get on top and ahead of the tension that's in the hips. Now, the third common thing that clients end up commenting or letting me know about and want help with is what to do about hip pain at night. And the first thing to do is, just like with the squatting, is to address the tension in the hip. So the foam rolling, going through the foam rolling before bed, taking 2 or 3 minutes to address the tension around the hip will end up helping when it comes to hip pain at night. Other things that you can end up doing, I'll get Andrea to demonstrate some of them. So lying on your side. So a lot of times people will say that lying on their side, that's what they end up doing, is lying on their sides. And if they end up having hip pain, lying on that side just leads to more hip pain, or just ends up aggravating that hip pain. So what you can end up doing is moving on to the other side, lying on your side, or you can end up changing your position and lying on your back and sleeping on your back. Now I know it can be difficult changing your sleeping position, so some other ideas are, if you end up laying on your side, you can end up taking pillows and prop up your body. Good spots end up being in the kind of the curve in your low back. Ends up being a good spot. You can end up putting a pillow underneath your hip. Other areas end up being good is to put a pillow underneath your knees, so the pillow ends up taking some of the weight of your legs, which end up decreasing the pressure on your hip. So those are kind of three pillow ideas that you can end up doing. And then the last idea ends up getting a foam topper for your mattress. You can oftentimes get it at any department store, like a memory foam topper. That will end up decreasing how much pressure you end up having on your hip area, which will end up decreasing that hip pain and helping you overcome that hip pain. Perfect. Thanks, Andrea. So there you go. That ends up being the complete 5 steps to get rid of chronic hip pain. Now, if you got benefit from this video and are looking for some other tips and tricks when it comes to overcoming hip pain, what I recommend for you to do is click right here. I have a free new report called 5 Tricks to Fight Hip Pain and Tightness. Just click right here, let me know where to send you that report, and I'll send you that report right away. Now, if you're watching this video on a mobile device like a smartphone or tablet, head down below into the description, click the first link, which will end up being exercisesforinjuries.com/hips. Let me know where to send the report, and I'll send the report to you right away. Now, if you've gotten benefit from this video, make sure to like it. If you have a question for me or another video idea that you want me to do, head down below and let me know in the comment section. Now, before you leave this video, make sure to subscribe to my channel so you end up getting future pain relieving videos.